Hi, it's Dr. Kevin here. I just wanted to talk to you about something that patients will sometimes ask me about kids in chiropractic or babies and infants in chiropractic and whether they need chiropractic as well. And sometimes people can't wrap their head around that because they might think, well, gosh, babies don't experience headaches, do they? Or do they get back pain? Like, why would they need to see a chiropractor? Well, the easiest way to explain it is as a baby's spine, and I've got a small spine here, you guys can see, as that spine is aligned, that's the way that that spine will tend to grow. And there's a saying that as the twig is bent, so grows the tree. So wouldn't it make more sense to keep things as healthy as possible in that young spine so that as they grow and develop and go through the stages of life, we will ensure that their spines and their nerve systems can grow as healthy as possible. So it's far easier to grow healthy kids than try to back up and repair damaged adults, although we still will repair damaged adults, but it's a lot easier to start from the beginning. So that's one reason. Another reason is when we look at what are the causes of potential problems or subluxations, which are misalignments of the spine. What are potential causes of that, and when can they first occur? Well, the first time they can occur is in the birth process itself, especially when there's forceps or vacuum extraction, or even worse, and a higher stress on the baby and on mom as well would be when there's a cesarean section. And that's where there can be tremendous amount in either of those cases of pulling and pressure on the baby's young spine, which can then cause the vertebrae to shift out of alignment, leading to all kinds of problems with the way that spine's moving and functioning, but also, and more importantly, the way that that nerve system's functioning as well. There can be interference with the way that the brain can send messages down the spinal cord, out the peripheral nerves to the different areas of the body, including organs, glands, blood vessels, muscles, joints, skin, you name it, everywhere in the body, every nook and cranny. It can affect the way that the brain can communicate with that body, and therefore affect the way that that body can express health. So the birth process is the first time when a baby learns to sit up, when they learn to crawl, when they learn to stand, when they initially learn to lift up their head even. Those are all milestones where there could be potential areas where they could have slips or falls, or they could jar their spine. And those are milestones, especially when it's important to have that young person, the baby, checked for subluxation. And then of course, when we think about in our own childhood, when we were with siblings, we'd be rough and tumble, we'd be wrestling, there would be falls that you have on the ice or in sports or what have you. And of course, we want to ensure that we can check to see that spine is healthy all the way through the growing years of that child. Not to mention the fact that we see more and more children on phones on a regular basis where their heads are turned down and focused on that screen. And of course, that will cause problems with the way that their spine is positioned, leading it to be in more of a forward position like that. That will lead to a whole slew of problems down the road, but the sooner that we can get to those spines and nerve systems and help to correct them and keep them that way, the healthier that child is going to be. So I hope that answers your questions about that. If you have any questions, don't hesitate to reach out to our office. We look forward to serving you and your family sometime soon.